Hey, it's your friend here from Book Podcaster. Look, nursing school, right? Sometimes it feels like they just hand you this massive fire hose of information and expect you to just drink it all.
Huh. That's putting it mildly. The sheer volume is something else.
Totally. So today we're going to take a sip, maybe a more manageable one, focusing on something really vital for psychiatric mental health nursing group interventions.
Ah, good topic. Super important.
Yeah, think of it like understanding how people coming together, rowing in the same direction, can really make a difference for mental well-being.
That's a great way to put it. And it's so key because group work isn't just some side thing in psychiatric care.
Yeah.
Often, it's where so much real connection and, well, growth actually happens.
Exactly. And we're digging into Chapter 9 of Psychiatric Mental Health Nursing, Concepts of Care and Evidence-Based Practice by Townsend and Morgan. Gonna pull out the need-to-know stuff.
Right, focusing on the core concepts.
Our mission today, pretty simple. Make sense of why groups are so powerful, how they actually work, and crucially, what your role as a nurse will be in making them effective.
No overwhelm, just the essentials you can actually use.
Because honestly, this isn't just an extra topic, is it? It feels central.
Absolutely not extra. Group work offers these really unique chances for people to learn from each other, get different viewpoints, and feel that community vibe. It can be incredibly transformative for recovery.
Okay, so let's start basic. When we say group in this context, what are we really talking about? What makes it a group?
Well, at its core, you need two or more people, and they need to come together with some kind of shared purpose.
Okay, shared goal. Got it.
But the real kicker, the thing that makes it work, is when they also develop that sense of belonging, you know, feeling like you're part of it, and interdependence, realizing they kind of rely on each other.
Right, so it's more than just being in the same physical space. There's connection, a shared aim. The book gives some good examples for psych nursing. What kinds pop up?
Oh, there's a whole range tailored to different needs. You've got support groups, obviously think grief support, substance use group.
Yeah, people facing similar stuff.
Exactly.
Yeah.
And educational groups, psychoeducation about conditions, maybe medication management, that sort of thing.
Learning the ropes.
Therapy groups using specific approaches like CBT for, say, anxiety or trauma. And then you have task groups, which are much more focused on getting something specific done.
Like discharge planning.
Perfect example. A task group working on a concrete outcome.
Seems really versatile. What are the big benefits? Why put people in groups instead of just one-on-one? What's the power there?
It's fascinating, really. The dynamics. Members often experience what's called mirroring, seeing their own thoughts, their feelings reflected back by others. That can be incredibly validating.
So you see you're not the only one.
Precisely. And they get feedback, but from multiple people offering different angles they might not have considered.
Different perspectives.
Think about someone maybe with social anxiety. Hearing others share their own awkward moments. It just normalizes it, takes away some of that stigma.
Yeah, that I'm not alone feeling must be huge.
It really is. Plus, you build these strong emotional connections, and crucially, it breaks down that isolation that so often comes with mental health struggles. That realization, okay, other people get this. That can be a major turning point.
Totally. Okay, you mentioned the different types. Let's zoom in a bit. Task groups, again, what's a nurse doing there typically?
Right, task groups solving a specific problem. Discharge planning is the classic psychiatric nursing example.
Okay.
The nurse is in there collaborating with the patient, maybe family, doctors, social workers, the whole team, really, making sure the mental health needs and support systems are sorted for when the patient goes back to the community.
Very practical, goal-focused. Got it. What about teaching groups? What's the nurse's focus?
Teaching groups are all about sharing specific information. A really common one is a nurse leading a session on, say, the side effects of a new antidepressant.
Medication education.
Exactly. Giving clear info, answering questions, empowering patients to manage their own treatment. Knowledge is power, right?
Definitely. Okay, now, supportive therapeutic groups. What makes them different? What's the main goal?
Here, the main goal is helping members cope. Coping with emotional difficulties, specific life challenges.
Like anxiety or grief.
Perfect examples. A nurse might co-facilitate an anxiety management group or one processing grief. The big thing is creating this safe, empathetic space.
Right, safe space to share.
Yeah, where members share experiences, support each other, learn coping strategies from one another. It's about that mutual support.
And then self-help groups, they're run differently, aren't they?
Totally different leadership model. They're unique because they're peer-led. run by people who share the same experience, not necessarily a health professional.
Like AA.
Alcoholics Anonymous is the classic example, yeah. The power there really comes from that shared lived experience, that mutual understanding.
Makes sense. And finally, psychotherapy groups. These feel like the ones people often picture.
Probably. These are led by licensed professionals, therapists, psychologists, maybe a specially trained psychiatric nurse practitioner.
Okay, so more in depth.
Yeah, they often dig into deeper psychological stuff, exploring relationship patterns, past experiences, working towards pretty significant personal change, like a trauma-focused group, for instance.
Wow, okay, so quite a toolkit of group types. Now, you get a bunch of people together. It's not always smooth sailing from the get-go, right? The book mentions stages groups go through.
It does, yeah. Based on Tuckman's model, first up is forming. Think of it as the initial polite phase.
Right.
Everyone's testing the waters, feeling things out.
The awkward first meeting vibe.
Exactly. Roles aren't clear, maybe some anxiety floating around. Everyone's on their best behavior.
Uh-huh. I can picture that. So what happens after the initial politeness wears off?
Well, then comes storming.
Yeah.
And yeah, things can get a bit lively. Conflict might pop up as people assert themselves. You might see challenges to leadership, maybe little subgroups or cliques forming. It's when disagreements start bubbling up, like when your study group argues about how to split the work.
Been there, the too many cooks stage.
Yeah.
So how does a group move past that?
Hopefully they move into norming. This is where the group starts finding its groove. Rules emerge, spoken or unspoken, about how to interact.
Okay, setting some ground rules.
Yeah, and you start seeing more mutual support, communication opens up, trust starts to build, the team starts to, well, gel.
Ah, finding the rhythm. That sounds better. And then,
Ideally, they hit performing. This is the sweet spot. The group's working effectively, there's high cohesion, people feel safe being open and honest.
things are clicking.
Exactly. They're focused on the goals, working collaboratively, really getting stuff done.
That's the aim. But groups don't last forever, usually.
Right. That brings us to adjourning, the termination phase. The group looks back, reflects on what they achieved, what they learned, and prepares to end.
Must be kind of bittersweet sometimes.
It really can be. Even if it was positive, there can be a sense of loss, saying goodbye.
And the nurse's role in guiding all this sounds pretty critical.
Absolutely vital. A skilled facilitator helps navigate these stages, especially through the bumpy bits like storming. They help create that safe container for the group to progress healthfully.
Okay, now the book also talks about what makes group therapy actually work. These curative factors from Yalom. Sounds like the secret sauce.
You could call it that. Irvin Yalom identified 11 factors. One big one right off the bat is installation of hope.
Hope. How does it work?
Just seeing other people of the group who are maybe further along or who've overcome similar things, it inspires hope that change is possible for you too.
Like seeing proof it can get better. Makes sense.
Totally. Then there's universality. We touched on this, that powerful I'm not alone realization. Hearing others share similar struggles just cuts down isolation and shame massively.
Yeah, that shared humanity.
Exactly. Imparting information is another learning stuff, gaining knowledge, both from the leader and other members' experiences.
Like crowdsourcing wisdom. What else?
Altruism. Actually helping others in the group. That boosts your own self-esteem and sense of purpose. It feels good to give support.
Interesting. Helping others helps you.
Definitely. Then there's corrective recapitulation of the primary family group. Bit of a mouthful.
Uh-huh.
But it means the group can become like a mini-family where you get to re-experience and maybe resolve old family issues in a safer way. Like finding your voice if you were always shut down at home.
Wow, that sounds potentially really deep and healing.
It can be profound. Then, development of socializing techniques, basically. Practicing better social skills right there in the group. Learning how to relate.
Okay, like a social skills lab?
Kind of. Imitative behavior is learning by watching modeling positive ways of coping or interacting that you see in others, or the leader.
Learning by example. Got it.
Precisely. Interpersonal learning is gaining self-awareness through how you interact in the group and the feedback you get. Understanding your impact.
Okay, self-discovery through interaction.
Yep. Group cohesiveness, that's that essential glue. Feeling like you belong, you're accepted. That creates safety and trust.
The feeling of we-ness.
You got it. Catharsis is about expressing strong emotions, letting it out in that safe space. And finally, existential factors grappling with the big life questions, meaning death, responsibility, stuff that often comes up when facing mental health challenges.
Wow. That's quite a list. So it's way more than just venting. There are all these active ingredients.
Exactly right. And knowing these factors really helps a nurse guide the group effectively to maximize that therapeutic potential.
Makes sense. So talking about the nurse's role, it sounds like they wear a few different hats in group setting.
Oh, absolutely. A nurse might be the main facilitator for a psychoeducational group, maybe co-lead a therapy group, help manage or support a self-help group in the hospital, or even just be focused on ensuring safety, especially if the topic is sensitive.
So lots of possibilities. What skills are really essential for a nurse doing this work?
Well, sharp observation skills are key. Reading the room, yeah, seeing the dynamics, noticing who's participating, who isn't,
Paying attention.
definitely. And top-notch therapeutic communication skills, obviously. Building rapport, encouraging sharing, handling tricky moments sensitively.
Right.
The source has that great real-life example. The nurse with the veteran in the PTSD group who kept interrupting.
Oh, yeah, I remember reading that.
Instead of just shutting it down, the nurse gently intervened and later explored why, thinking it might be linked to trauma-related impulsivity. It shows that deeper understanding looking beyond just the surface behavior.
That's such a good example of therapeutic thinking. Now, leadership style, that must make a difference too, right? Who's steering the ship?
Huge difference. The book highlights three main styles. First is autocratic. The leader calls the shots, controls the direction.
Then bossy.
Can be efficient, but yet limits input from the members.
Yeah.
Then there's democratic leadership.
More collaborative.
Exactly. Encourages participation, shared decision-making. This style really builds trust and fosters creativity, and the source points out it's generally the most effective for therapeutic growth in psych settings.
That makes intuitive sense, empowering people. What's the third one?
Laissez-faire, which is basically hands-off, little guidance from the leader.
When would that work?
It can work for highly functional groups, like some
Awesome
self-help
stuff.
groups where the members are really driving things themselves.
Yeah.
But usually you need more structure.
Okay, so it depends on the group's needs. Now, groups aren't always easy places. What are some common bumps in the road, challenges?
Oh yeah, definitely not always smooth. You get common issues like dominant members who talk over everyone.
The monopolizer.
Right. Or the opposite, really silent, withdrawn members. Resistance is a big one, people pushing back against the process.
I can imagine.
You might deal with relapse or crisis situations coming up within the group, people becoming overly dependent on the leader. Even tricky dynamics like splitting, where members pit people against each other, or triangulation.
Wow, sounds like you need to be ready for anything. What does the source suggest for handling that stuff?
Well, active listening is fundamental, really tuning in. Skillful redirection, gently guiding the conversation back on track, or ensuring everyone gets a chance to speak.
Steering things carefully?
Yeah. Normalizing discomfort, letting people know it's okay to feel awkward or anxious sometimes. Setting clear ground rules right at the start is crucial for expectations and managing behavior.
Ground rules are key.
Absolutely. And sometimes, especially after intense sessions, you need time for debriefing, just processing what happened.
This has been incredibly helpful, really breaking down group work. So if we were to wrap this up, what are the absolute key takeaways?
I think the big thing is that groups in mental health are like these powerful mini communities. They mirror the outside world, but offer unique chances for insight, feedback, safety, and just solidarity.
That feeling of connection.
Yeah. And psychiatric nurses, you play such a vital role in making that happen, in facilitating the growth and healing within those groups. Honestly, getting good at understanding and guiding group dynamics is a fundamental skill for effective mental health care.
So for everyone listening, juggling all those readings, all those clinicals, remember this group dynamic stuff isn't just abstract theory. It's about learning how to foster real connection, real healing. You're building skills that genuinely change lives. You absolutely got this.
Totally. And maybe a final thought of, think about groups you're part of, even outside clinicals. Study groups, teams, family gatherings. How do those dynamics work? What makes them tick or not tick? Observing those everyday groups can actually teach you a lot about the human need for connection and how we navigate challenges together. It all connects.